Hi everyone, my name's Tamika Newman. I'm an international board certified lactation consultant, and today we're going to have a chat about latching your baby. So there's often some myths that float around out there that breastfeeding should be painful for the first couple of days, weeks, that a little bit of nipple damage and discomfort is actually normal. And I'm here to kind of blow that myth out of the water a little bit and just kind of say that it's actually not normal for your baby to actually be causing you any pain or discomfort at all during your feeding journey. It is quite, I guess, common or normal that when your baby first latches in the first couple of days, there can be a strong tugging sensation because obviously you're not used to having a baby latch and feed on your breast. However, it definitely shouldn't be painful, pinching, biting, stinging, burning. And when your baby actually finishes a breastfeed, then your nipple shouldn't change shape at all either. So today I'm here to just show you a really quick, simple little latching technique to help you latch your baby to the breast and hopefully make it as painless as possible. So what I want to talk you through is, this is my little doll baby, and I want to talk you through, I guess, breastfeeding mechanics. So essentially, if you run your tongue along the top of your mouth, you've got a hard palate and then you've got a soft palate. Ideally, we want to get the breast. So what we have to remember is babies are breastfeeding. They're actually not nipple feeding. So it really doesn't matter what your nipple looks like, whether it's flat, whether it's inverted, whether it's small, whether it's large. Ideally, the baby needs to be able to open their mouth as wide as they can and take a deep enough latch so that the nipple can actually go right to the back of the baby's mouth. And so when the baby's tongue is undulating and moving through the midsection there, the actual nipple is sitting right in the back of that baby's mouth, and it's actually sitting between the junction of the hard and the soft palate. So how do we get your baby to latch? Okay. So when we look at a baby, if you all want to just sit there for a second and put your chin to your chest for me, if I was going to hand you a glass of champagne, would you put your chin to your chest and try and drink it? No, because mechanically we can't do a really nice swallow when our chin is on our chest, and our babies are exactly the same. So essentially what we want when we're achieving a really good latch is we want to bury baby really nice and close into mum's body, and we want this really nice head extension. So kind of in the sniffing position, or I like to call the drinking champagne position. So when your baby is latched, we want a really nice wide angle through their jaw so that they can have a really nice deep latch, that their chin is actually buried into the breast, and that their gum line is right up on the areola on the top here, and that their little tongue is actually using that we're using their tongue to drink and create nice vacuum and seal so that we can transfer milk from breast to baby. So how do we achieve that? So firstly, we want to line baby up. Just move my camera down there a little bit. We want to snuggle baby really nice and close to mum, okay? And it really doesn't matter where you hold your baby at all. Essentially, we want baby's shoulders to be supported, and we want to allow the head to extend back as far as we can. So what often mums will do is they will actually put one of baby's hands underneath the breast and the other hand on top of the breast. And then I'll go from the side view, and what we actually want to do is we want to bring baby's kind of chest and body into the breast. We want their chin to touch the breast, and the nipple should be kind of pointing up towards their nose. So depending on your breast shape, you may need to just gently shape your breast, and you can do that by just placing a well-placed finger in here to anchor your breast tissue and then kind of pull the nipple away so that baby's mouth is actually coming in here and can come up and over the top of the breast. So we can either go this way, or you can put a finger this way, and some mums don't actually need to touch their breast at all because they can just guide their baby with the other hand. So we're going to pop baby either side of that breast. We're going to bring the nipple right up to the nose. We're going to bring the chin into the breast, and when the baby gapes, we're actually going to bring baby up and over the breast and nipple. And then once you're actually on, this is a little Tamika tip. So once the baby's actually latched onto the breast, what we want to do then, so say we've kind of come up and over and we're too far towards towards our shoulder and towards our arm, what we can actually do is even swap hands and gently push in through the baby's shoulders. And I'll just put that one down. And we can actually bring them back this way as well. So what we're encouraging, if baby gets a shallow latch this way, by gently pressing through those shoulders, it actually helps mechanically open that jaw wider and allow that the nipple and breast tissue to go deeper in that baby's mouth. And you'll actually notice that when baby gets into that nice head extension pose, they will actually start drinking a lot better. And so what you want to be seeing with an ideal latch is that the top lip doesn't need to be fully everted or fishy lips. Like, basically the lip just needs to sit flush with the breast tissue and not be moving in and out as it's sitting there. The other thing that we're looking for, and obviously this baby's mouth doesn't move, but basically what we're looking for is we want that nose to be really nice and clear of the breast. We want the chin to be buried right deeply into the breast. We want to see a nice wide angle through here and not a really shallow jaw. And we want to be seeing that those baby's cheeks are actually touching your breast. So if you're actually seeing anything of the lips kind of from here down, I'd be saying that your baby is actually quite shallow. So in midwifery textbooks and what I was taught as a midwife, we were kind of taught to look for special K-lips. However, I find that looking for special K-lips can actually lead to some problems, because if we're seeing these really shallow little fishy lips, it tells me that the baby doesn't actually have enough breast into their mouth. So what we're looking for, that nice head extension, we want baby's cheeks touching the breast. We want to be seeing nice clear nose space, and that the angle of the jaw is really nice and wide and not shallow like this, if you were to draw a little line along baby's top jaw and bottom jaw. The other most important thing is that it should be a very comfortable latch. There should be no pain, discomfort, pinching, stinging when baby's latched. And also you should be able to see that your baby is drinking very well. So what we expect to see, baby will jump on, have a few quick sucks, and then when you see, you can usually hear when you're getting a letdown, or you can feel when you're getting a letdown. And what you will see is your baby should be drinking kind of two to three sucks per swallow. So suck, swallow, swallow, suck, swallow, stop, pause, breathe, and then suck, swallow, or suck, swallow. So there you have it. There's Tamika's tips on how we get a nice comfortable latch while we're breastfeeding our baby. And I hope you have a great day. Thank you.